here in just a minute. For those of you who are just tuning in, we're glad that you're here. We host these webinars every other week at Friday on noon, and would love for you to join us for more. They are always free and informational. The past, let's see, the next probably 4 webinars are going to be focused on marketing coming up. So we are very excited to talk about that. That's always one of our most important and frequently asked questions. As you're going to hear today from Dr. Singh, who's kind of a marketing guru that is always important and a new part of your job as a small business owner. So make sure that you're registered for those. If you want to drop your email in the chat or send it over to one of the hosts here, we're happy to add you to that list for the future. Let's go ahead and hop in, Dr. Singh, because I know you have a busy day ahead too, and I don't want to keep you too long. But so I am Sarah Harker from Freedom Healthworks. I'm the business development manager here, and I'm most likely the person you'll be talking to if you have questions about resources you need to start your DPC, or if you're already in a DPC and looking for more support. I'm most likely the one that you'll be talking to there. So I'm sure we'll meet soon. I was lucky enough to get to meet Dr. Singh at a conference, the first ever, actually, pediatric DPC mastermind in Orlando. Was that last month already? I think
yes, it's February, right? February, I think. 2 months.
April. Time is flying. So I got to hear her speak there, and I'm really excited for you guys to get to hear from her as well. She gave a really amazing talk about building your business and all of that hustle that's required to get that going when you become a small business owner. I'm so excited for you to hear from her today. Dr. Singh, do you want to give us a little bit of, I'm going to stop sharing my screen here so we can see your whole face. Do you want to give us a little bit of background on yourself and what brought you to DPC, about your business that you own now, and kind of that focus of your practice?
Yeah, well, I just want to thank Sarah for inviting me to do this webinar. I'm excited to share my story. You know, as a DPC physician, it's always great to share your story with others so it can make them passionate about DPC and learn more, and maybe make the jump and leap into doing a DPC practice on their own, because, a lot of people don't have the courage to do it. So I want to give everyone the courage to just try it. So the way I got into it was I was in insurance model world straight from residency, and I was working there for about 4 years, and it was a physician-owned group, and the hospital took over. Once the hospital took over, it was just unfortunate that our schedules were dictated by people that had a business degree and thought that, numbers, and not thinking about the patient. And I didn't go to medical school to practice medicine like that. And I knew I wanted more. I knew there was more to medicine. I knew I didn't want my future to be like this. And it was, already just 4 years. And a lot of people don't stay that long in their first job, out of residency. Usually within the first year, you're changing jobs because you don't really know what you're looking for. And so I was fortunate to go to a DPC conference in DC in 2017, and sponsored by AASP. And I sat in the conferences, and I learned a little bit before that on what it was about. And I just walked out of one conference with my dad, and he's my cheerleader. I've said this in the past at the conference we were at, and just wanted his emotional support, not financial, not anything else, just emotional, to say, sure, give it a try. What's the worst thing could happen? You just start working for somebody again. So I ended up in 2017 finding a location, coming up with my budget, figuring out all these things that as a physician, you never thought you needed to know or learn. And it was a lot of work, but people like Sarah can help guide individuals to do this if they don't want all the burden on themselves. So I found my office space in November 2017, and February 2018, I opened doors having 0 patients. I was in a new location from where I was before practicing. It was 4 hours away. So, where people say, oh, you have to be established in an area. No, you don't. People also say, oh, you have to have like a Whole Foods and Target and all these like demographic stuff. You don't. Okay. So again, only thing you need is yourself and believing in yourself and just putting yourself out there. So that's been my story.
Mindset is such a big part of DPC. Really, it's a big part of owning any small business or big business. You know, you have to switch from that mindset of doc to business owner, and you're kind of wearing both hats there. While you're going to find a lot more balance with life and work, it's also you're always on. There's a big part of you that's always making those connections. And one thing that we really love to do is, you know, help you focus on that in a natural, genuine way. You're always building those relationships, and not so that you're, you know, kind of selfishly in this mindset of going to meet people to convert them or something like that, but that you're trying to meet people and really connect and be out there. We often get a question about, you know, if I'm introverted, can I do this? And my question is always, sure, but you have to be willing to get out of your comfort zone. So, you know, you have done such a great job with that. And I appreciate you saying that we're here to help, because we definitely are. You know, there's so many different ways that you can go through DPC. There's people who do it all on their own, like you did, from the ground up, and you most certainly can do that. I always tell people, you know, if you went to medical school, you can do just about anything. You clearly are able to put your mind to something and work towards it. For people who are wanting to, you know, spend less time figuring the way out, or maybe they don't have the time or the financial commitment to be able to take time off until they break even, we're here to help you get that going and open in 90 days. But there's room for everybody here, and we are all, just both of us, so focused on helping anyone in any way that we can get them into DPC, because we know it's going to be a better market for everybody as a whole.
Yes, definitely. I agree 100%.
Yeah. So, thank you for sharing your story and how you got there. I think it's so cool that you jumped right in like that. And I also like that you mentioned going to the AAFP conference. And we heard a lot at the pediatric DPC conference about how many people that they've connected there. And I think somebody was joking about their table. They had like a whole pediatric table there of DPCs just trying to meet each other. And I think that that's a really good point that we'll talk about a little bit later, about finding your people and keeping going through this whole process. So to just kind of piggyback on that, when you open a DPC, we know that you're the face. You're building this business and you're the front of it. People are coming because of you. So tell me a little bit about when you got started. I think people can probably already tell from meeting you for like 2 minutes that you probably weren't super intimidated by it, but you'd be surprised. Was it intimidating or exciting for you?
No, definitely it was intimidating. And now after 5 years, I've built up this courage. I was an introvert, believe it or not, and I didn't really care to talk to people, to go and speak in front of people. But you know, when you have your insurance model practice, you just show up. Your patients are on your schedule, and that's it. You don't really have to do meet and greets, and you don't have to go into the community, and you don't have to do all these things. And with DPC, you have to go out into the community. You have to get to know the community, but it's beautiful to get to know, you know, other small businesses like you that will support you. And then, you know, you're the best, you know, marketing tool is to go out and sell yourself. So I always tell other DPC doctors that I'm mentoring that who better to market yourself than you? You're the face of the business. Yes, there's marketing companies out there, but I would recommend you doing it, you learning, you know, how you want your business to be represented as.
Right. Yeah, we talked a little bit about that yesterday. I know both of us have heard kind of the horror stories from other DPCs that invested in big marketing firms that just kind of group them in with, oh, you're a doctor. Okay, here's medicine. And when in reality, when you're marketing your DPC, you're really looking more towards membership-based services than traditional medicine isn't that competition. And also other DPCs aren't your competition. It's all about that collaboration to help move that movement.
When I got started, there were only 700 DPC doctors in the country. Now there's close to 2,000 plus. So it is definitely growing. And I love to share the story. I love to spread the word. I never charge. And it's just something that, you know, if you're passionate about it, you want others to do it. So if somebody opened up two doors down for me, we're all different. We all have our own unique niche. So like there's this
Yeah.
motto in a DPC world, you've seen one, you have not seen all. So
Right.
each one is individual, unique,
Yeah.
and it's just, you definitely can help others.
Right, right. And be there to, I think that anyone who's tuning in that's just getting into things and researching DPC they're going to find that surprising. Traditional medicine world, you're used to a lot of competition and kind of butting heads in a lot of ways in those different conferences that I can remember going to. And now when you go to a conference like what you went to, there's collaboration. Everybody wants to cheer everyone on. They want to say, this is what worked for me. You should try this. Have you met this person? You're going to make so many great friends with this. And it's just such a cool community to be a part of. Let's talk a little bit about, you're talking about marketing. What are maybe one or two things that you've done for your marketing, for your practice that you felt really led to memberships? We hear all these, fails of I tried this and this didn't work. And what are one or two things that worked for you?
Yeah, so what worked for me was I have, if you can see, my logo and my name on my t-shirt here. And that's in my last job, I wore business casual. I always got dressed up. In this job that I have now, or my DPC practice, I got scrubs, I got shirts, I got them made with my name and embroidered at the beginning. So anywhere I went, breakfast, lunch, grocery store, after work, people would see it, people would read it, they see my logo, they see my name. So it was like in their face constantly, and people are curious, they want to see, well, what is she? Is she a nurse? Is she a physical therapist? Is she this? Oh, she's a doctor. Oh, where do you work at? And it's a good conversation piece. So I thought that really helped me. One. Another thing that helped was I got affiliated with the chamber. I also found different breakfast groups, lunch groups. I wasn't too fond of the evening groups because there's a lot of happy hours and it's a different crowd that you might get. And I felt, the lunches and the breakfasts were more my thing. And also moms groups, women's groups. I just kind of had a niche towards that. I felt like if I got in a good relationship with a woman, I felt she was my biggest advocate and cheerleader at the end of the day. I have men who are my cheerleader too, but the women I tend to click to. We small businesses, you want other women to succeed just like you do. So I wasn't a fan of BNI. BNI is business networking, I think international. And it was just because they're so rigid. And as a physician, we never know when we have an urgent patient or when we have an urgent call. And so BNI, you have like these set rules. You have to be there every week. You had to give referrals. You have it's a have. And I just, again, why are we doing DPC? You're doing it to have flexibility. You're doing it to have that control of your life. I didn't feel that fit with me, but others have really, been successful with BNI and Facebook and social media. I'm an introvert. I really don't like to put my face and talk, and I'm trying to do better like this.
You're getting out of your comfort zone, right?
I am, exactly. So I'm getting out of my comfort zone every day. That's the only way we can grow. Yeah. So I feel like those were things that helped me in the community. I would, do some little sponsorships where I set up booths and I took blood pressures and acne checks and, kind of coincided with other like-minded colleagues that did massage therapists and acupuncture things. So we would set up a booth together at fairs and at just community events to get to know the community. That's what's really important, is to know your community. And once you know your community and they know you, they're your biggest cheerleader, and they're gonna, gear and steer people your way.
Right. I love how relational DPC is. I mean, when you give yourself the time to get to know your patients and you give yourself the time to get out there in the community, like you're talking about, I think that's probably part of why you were kind of felt an aversion from that one group, is there's these rigid referral restrict, and it's not genuine connection. And you, just knowing you as much as I do, I know that you build that genuine connection, and it's more about that relationship than I've got to check this box. So exactly. I agree with that totally. We are always encouraging people to look for those free groups too. There's loads of free groups in your area. I love that you said the women in your community too. I found There are quite a few women in business groups that don't charge a fee, or if they do, it's for lunch or whatever is provided. But people want to help you succeed even outside of the DPC world, once they understand what it is.
Yeah, exactly. It's explaining it to them because they're like, "Oh, you're concierge," and I don't like that word. It's but everybody has their own little verbiage that they like. I personally don't like it. For me, it's not my practice. I want my practice to be open to all socioeconomic backgrounds. And so I really want it to be a resource for everyone. I don't want it to be that concierge VIP, stigma. So that's why I don't use that word in my, I may say concierge like, but
Right.
with a more affordable price.
Yeah, I like that term of concierge type service, affordable for all or accessible for all. I like it when people explain it that way, as it does seem like people tend to understand that word concierge, but then they're like, well, that's the same thing. And you're like, well, do you know how much that costs? So
Exactly.
that's a
Exactly.
big focus for your practice of being accessible for everyone that makes the impact. And I think it's really cool coming from you, having a full practice and adding on practitioners. And as your practice is growing, for people to hear, that's not going to mean anything about the success of your practice. If you're affordable for everyone and you're accessible, if that's where your heart's at and you're making that practice match with that, you're going to see it. You're going to see the growth, and you'll find your people. I love that you're wearing your logo there. And that's one of the best ways that you found for referrals and getting people in your doors and in your office to see the difference that you provide. That's another way that we often coach people through getting out there. We have a doc that I talked to recently who loves to run, super introverted, who connected with a local company there, a running store that had
Running
just
group, yeah.
and he just got involved in the running group and wore his shirt, and those conversations started. Again, you make it what you want it to be. You're the boss. It's your practice, and that's the way you're going to find those people and get in front of them. I love that. Thanks for sharing it.
Of course. Thank you.
And what advice do you have for doctors or providers that are new to DPC and in that research phase, besides get out there? What else would you recommend?
If they already are part of a group right now, they're working for a company, I would highly recommend getting your patients to write reviews for you. Reviews are gold. So before I left my practice, I set up a personal Facebook page, just my name. That's it. Didn't have the company's name, didn't have anything else, just my name. And I asked my patients to leave reviews, and they left amazing reviews and left, they're so sad that, I'll be leaving and all this stuff. But it was validity to, I'm a good doctor, I'm reputable, they trust me. And it's just helping me go to a new area where I have to start from zero. Nobody knew me. I'm not getting 100 patients, knocking at my door or pre-enrolled. So I had to start from scratch. So at least I had some reviews that was kind of holding, my credibility.
I love that.
So that I felt, and I have been telling other DPC docs that are about to start, do that, get your reviews. It's always great. You may not be able to do a Google review yet, but at least you have Facebook, and it's a reputable source. So then when you do have your Google reviews, you can always kind of stare it back towards the Facebook reviews, and they can kind of see that as well.
Yeah, and if anyone goes to check out your page on Google now, they will see that you are totally preaching. You have so many Google reviews, and I love that you aren't afraid to ask for that. I think it's a hard switch for people to go from asking for those reviews, especially from the traditional medical setting. That's not based on that. It's just, where does your insurance go? It's not even, people usually only leave reviews when they're disgruntled. And then you can also do it in the community, right? So like when you're going out and you're speaking and reminding people, I love referrals just like you do, post on my Google reviews, because it's going to boost everything. So
exactly. Like I personally, if I'm going to go to get a facial or going to a restaurant, I'm going to look at reviews. They, they mean something. So if you have good reviews, of course, it's always good to have some bad ones too. So you're real. So I always tell my patients that I'm like, look at my reviews, or if I have a meet and greet, I'm like, look at my reviews. I'm a real person. I may not click with everybody. That's why I always recommend that, I don't feel like DPC, there's competition because we all have different personalities, and you may get along with me, but the next person may not, we may clash. So it's okay. It's okay.
Yeah. And it's so easy when you're getting started to really hook on to that of, oh my gosh, I got a negative review. And I love the way that you just phrased that, because it's so, you're a real person. It's okay. So keep going.
But at the beginning, it broke my heart. I was like devastated by it. I was devastated when a patient canceled their membership. It's just that, you're putting your sweat, blood, and tears into this. And
Right.
when things don't go your way as a physician, sometimes with a personality type A personality, you tend to get your feelings hurt, but you have to grow. You have to grow with it and accept it and understand that, hey, oh, well, they'll, wish them luck and they'll go on their way. And I hope they're cared for by somebody else.
Yeah. So how do you respond to those reviews, and how
I
do
do. I do. And I have a staff member that he responds, but he sends it to me first and I approve it. And, we're sending it, at the end of the day, we just want the best for our patients. So we may not meet the expectations of everybody, but we're trying to, and we're only human, at the end of the day, we're human, and there's mistakes that can happen and misunderstandings. But yeah, so if 90% of my reviews are good, then I'm happy.
Yeah, that's such a great outlook. Awesome. And so I asked you about people coming new to DPC. What about one question that you'll hear every now and then is, I've been in this for a couple of years, things are kind of plateauing. What do I do? And I loved your advice when you spoke on this at the mastermind. And I want to get your take on that. But what I remember you saying is, don't stop getting out there. You can't just set it and go, right? So tell me a little bit more about that.
Exactly. So all last year, believe it or not, I got so wrapped up in just the practice growing, new physician, new staff members, just growing. And I forgot about my networking. So this year, when I started, I was like, okay, I have to get back into networking. I have to go back out in the community. So it's just really important to make sure you're sticking to those meetings and trying to get to them, and, making time for it.
Yeah.
Making time for it.
Yeah, I feel like that part never really stops. You can, take a break. If you're tired, goodness, take a break. We don't want you ending up where you were before you got into DPC, right? It's to take care of yourself. But still continuing that. I know there's all sorts of ideas for what you can do with that. But I've met people who try to go to just coffee with somebody they've never met before once a week. There's all sorts of kind of games that you can play with yourself to keep it going and keep it interesting. And again, gear it towards yourself. If you're introverted, then maybe you don't want to go volunteer to be on stage. Try it. Maybe you don't know. If you've never tried it, maybe you'll like it. But, maybe go to like a yoga studio and get to know that. But think about how you can also kind of kill two birds with one stone of fill yourself back up, and also, wear your gear, wear that swag out and about.
Exactly. Like, if, like you said, if you're not in the mood, if you don't feel like it and you don't want to get out in front of a big crowd, then do those one-on-one, meets with other people that you've never met. So highly recommend that. And just looking on Meetup has a lot of free events, Facebook groups. I think it's like Facebook events. They have a lot of free ones as well. So you can always find these free, groups, and they're sometimes small, sometimes really big. So you kind of, like you said, you can gear it towards what you want. Even go to a yoga, class. I meet a lot of people at yoga classes. So I love interacting with that.
Yeah. Yeah. I am paying attention to the time here, as I know we are trying to keep this a little bit shorter for people tuning in. I do have one question here that came in about events at your practice. Have you had any success with having any events or like grand openings, I think is probably what they're referring to?
Yeah, so I didn't do a grand opening, but I did a year anniversary. And I actually, it was sponsored with Sedera Health, who so they're big DPC advocates. So I personally have Sedera. So they actually joined, and I did a talk about DPC. And so it was great. We had other local vendors like different gyms, different restaurants, and we set it up in the parking lot. And it was a beautiful event. I hired a face painter for the kids,
Oh, that's a good idea.
Yeah, it was really nice, and they got to come into the office and get like a tour, and then I had somebody doing acupuncture, and then we had an in-body machine. So we just had different little stations, and so it was really nice. So I did that. I just did that one after the year, but now we're going on year 5, and we're moving to a new building. So we're excited to do a grand opening there over the summer of this year. So that's going to be our big event we're going to hopefully get to this year.
Well, congratulations. That's so exciting.
Thank you. Yeah. So we've outgrown our space of 1,200 square feet, and now we're moving to double the size.
That's awesome. Awesome.
Yeah.
Well, so when you were looking for your second location, did you take into account anything for marketing there? Did you feel like the place where you started was a good fit and it's just a growth thing, or was it also kind of that location that you always hear?
No, so I got lucky with my location. I was really looking just for my selfish reasons to east of Fort Lauderdale because it was closer to the water. That's where I wanted to live. And so happened I found a space in Plantation, which I've never heard of. It's more west, kind of middle central of Fort Lauderdale area. And it is a plastic surgery center. But it also has upstairs other doctor's offices like a dermatologist and a pain management and a NAMI. And so they had their consultation suite available that was renting, and they were giving it all the furniture included and examining tables and everything. So all I had to do was go and just show up. And they actually gave me just a year lease as well, which, I mean, as a small business owner, you never see that. You never hear of, you have to sign this 3 to 5 year lease that I was looking into. And so they were just giving me all these really great benefits with it. It wasn't my ideal place. It was very close to the hospital, maybe like walking distance to Plantation General, but it wasn't a location that I needed a hospital or was going to, it was just kind of by fluke. So I took it just to try it out. And I honestly would say location does not matter. I have patients right now as far south as Homestead, which is about a 2-hour drive from my location. I also have as far north as Jupiter, which is about an hour, or Naples, which is on the West Coast. So I even have patients in Orlando that end up moving there, that they're still come back to me for their physicals, but everything else I can do over the phone. So as long as they come to me for their physical, everything else they're happy with. And, if they do have to drive to see me, they're doing it. They're still doing it. So now I have a patient that's living in like the country, Panama, that comes to do his 1-year physical. And so I have like all these random people that are just hearing from other patients that just wanna join.
I may volunteer to go to Panama to do their physical. That's awesome. We've got one more question here, and then I'm going to wrap things up and let you get back to your day. Community partners, have you done anything? You mentioned yoga, that you love doing that yourself. Have you ever connected with any other community partners, like a gym, a spa, yoga studio?
So I connect with them. I have a lot of patients that own their own yoga studios, Pilates studios, Reiki. So I am personally a yoga instructor as well as a Reiki instructor. So when I first started my practice in 2017, as just kind of my own education, I went to Bali for 8 weeks. 8 weeks, I became a yoga instructor and a Reiki healer, just for my own selfish reasons, because I've been practicing yoga for so long. And I didn't know if I was going to fit it into my practice. And believe it or not, at the beginning, the first 2 years I did fit it in. I was doing one-on-one yoga with patients. I was doing one-on-one Reiki sessions with them. And it was beautiful. They loved it. But after COVID, I decided to stop that. And I just needed to just stick to medicine. But it's definitely something that I refer my patients to yoga studios. I refer them to gyms, to, different spas and facials. So I have the connect, meaning that like the connection, and we refer back and forth as colleagues. But I've never set up any type of like event with them directly. Like for my event, I had a yoga instructor come and do a yoga class. So it's definitely something that I'm recommending to my patients. So it's nice. I've reached out to chiropractors. I've reached out to, other just other types of specialists. And so I'm able to pick up the phone if I need my patients to be seen by them, or, they're referring patients to me. So it's a good relationship so I would recommend getting out there, meeting all these different small businesses in your community, so they can be a good resource for you to refer, as well as them referring patients to you.
Very good. Great. Is there any other wisdom you'd like to end this on or share? I mean, you've covered a lot of territory in a quick amount of time. So
Yeah, well, I just want to thank you again for having me on. And if anybody had any questions that they wanted to email me, please share my email with them. And don't be afraid, with the whole model of you being on your own and you practicing on your own. It's something scary as a physician, because I never thought in a million years I'd be an entrepreneur. But you have such a great support system on Facebook. There's DPC Docs. You have the DPC Alliance. You have Freedom Healthworks. So all these different resources to help you in the community. So I'd highly recommend taking a leap, taking a chance, believing in yourself. And also, I know we had this discussion, Sarah, thinking about your future, thinking about how you want your future to be. Do you want to work for somebody for the rest of the life? Do you want to have your own freedom? How do you want to practice medicine with your patients? How long do you want to spend with them? So thinking about these things and figuring out your why, which is very important, and then deciding if you're ready to take the leap.
Awesome. Well, thank you so much. I really appreciate you taking time, and you're always such an encourager for the whole movement of DPC and your peers. So I really appreciate that. For those of you who are catching this recorded, which most people do catch it recorded, and I will be sending out our recording with that, all of our information for how to get in contact with me if you have questions for me, or with Dr. Singh as well. It looks like she also added in our chat here her contact information, and you can of course follow Aspire too on social. So I'll send that out, and if you have any other further questions for us, please send them our way. We'll be happy to answer them. We do try very hard to get through all of the questions that come in, as that's really important to us. Also, feel free to reply to that email that's coming out with our recording with any other requests of topics that you'd like to hear about. We know we did kind of marketing as a whole in this call, and you could spend a whole session on each of those questions that we asked you. So we do want to make sure that we're offering you really helpful information. So thank you again for spending your lunch with us, and we will look forward to talking with you soon, hopefully at a summit of some sort this year. I'm sure we'll run into each other at one of the conferences.
Yes, sounds good. Bye.
Okay,
Have a
see
good
you, Dr.
afternoon.
Singh.
Thank you.
Bye.
Thank you. Bye-bye.